Derelict, damaged, even dangerous. Shocking pictures from inside Brighton General Hospital and the reality of an NHS trust having to shut down wards and clinics because the buildings they're being asked to use are no longer safe or suitable for patients.
It was never designed to be a healthcare building, it was designed as a Victorian workhouse. And so as healthcare has changed and is delivered in different ways, we've simply not needed the extent of the land and the buildings.
As a consequence, 20% of the site is being closed down, but it's still costing the Trust millions just to stop it falling into further disrepair. Not to be confused with the Royal Sussex Hospital that sits in the centre of Brighton, the Brighton General lies on the edge of the city, occupying a site the size of 4 football pitches. For 2 years, the Trust has worked on a business case to sell the site and build a modern medical centre to serve patients from across Sussex. The scheme has its critics, but there's no money coming from central government, and with Brexit concerns and NHS reconfiguration, that business case has been delayed again.
And what we want to do is to show people for the first time the state of disrepair of some of those buildings, to really make it clear about how important it is to build a new modern healthcare hub. And so it's really an opportunity for people to see why the case for change is so compelling for a new build.
This week, the government has announced plans to build 40 new hospitals and funding for 6 to start work, but none so far in the southeast, despite many trusts in the region requesting financial help.
If your problem is that you're not investing enough in maintaining buildings and equipment, I think that can lead to delays in patient care, it can lead to poorer quality patient care, it can lead to increased costs, and it can also impact on staff morale. So I think the recent announcement on extra capital funding for the NHS are a welcome start, but it is very much only a start.
The Sussex Trust hopes to have their business case signed off next year, and in the meantime their staff will continue to use the parts of the site suitable for patients.